Imagine a child who wakes up in the middle of the night, terrified, sweating, and unable to breathe properly. He refuses to talk about what's bothering him, but at school, he's withdrawn, easily startled, and has sudden emotional outbursts. Another child, after experiencing a serious car accident, starts avoiding cars altogether, panicking whenever she gets near a busy street. These are just glimpses of how trauma affects children and why trauma-informed therapy is essential in helping them heal. Childhood trauma is more common than we think. Studies suggest that by the age of 16, over 60% of children have been exposed to at least one traumatic event, including abuse, neglect, natural disasters, serious illness, accidents, or witnessing violence. The CDC's Adverse Childhood Experiences study found a direct correlation between childhood trauma and mental health disorders, substance abuse, and chronic illnesses in adulthood. The effects of trauma are not just emotional, but deeply biological, altering the brain's structure and function, particularly the amygdala, hippocampus, and prefrontal cortex, which are responsible for processing fear, memory, and emotional regulation. One of the biggest challenges in addressing childhood trauma is that children often cannot verbalize what they are going through. Unlike adults who might say, "I'm having nightmares about what happened," children often act out, withdraw, or develop physical symptoms like headaches and stomach aches. This is why trauma-informed therapy goes beyond just talking. It recognizes the unique ways trauma manifests in children and tailors interventions accordingly. One of the most well-researched approaches in trauma-informed therapy is trauma-focused cognitive behavioral therapy. Developed in the 1990s, TFCBT is an evidence-based intervention specifically designed for children with PTSD or trauma-related disorders. A groundbreaking study found that over 80% of children who completed TFCBT showed significant reductions in PTSD symptoms, anxiety, and depression. The therapy focuses on helping children process their traumatic memories, reframe negative thoughts, and develop healthy coping strategies. Another powerful method is eye movement desensitization and reprocessing. Initially developed for adults with PTSD, EMDR has been successfully adapted for children. It involves bilateral stimulation, such as eye movements or tapping, while the child recalls traumatic memories, helping the brain reprocess the trauma in a less distressing way. Studies indicate that EMDR can significantly reduce trauma-related distress in as little as 6 to 12 sessions. Play therapy and art therapy also play a crucial role in trauma healing. Since children naturally express themselves through play and creativity, therapists use sand tray therapy, puppets, storytelling, and drawings to help children process emotions in a non-threatening way. A well-documented case study involved children who survived Hurricane Katrina. When asked to draw their experiences, many depicted rising water, broken homes, and fearful faces, which gave therapists insight into their emotional states. One of the biggest breakthroughs in trauma research came from Dr. Bruce Perry's neurosequential model of therapeutics, which emphasizes regulating the nervous system before engaging in therapy. This means that instead of immediately discussing traumatic events, children first engage in soothing activities like rhythmic movement, deep breathing, or sensory play to create a sense of safety. Creating a safe environment is crucial in trauma-informed therapy. This is why schools, hospitals, and child welfare agencies are increasingly adopting trauma-informed practices, ensuring that children feel heard, validated, and supported. However, there are common misconceptions about trauma-informed therapy. Some believe that young children will just forget trauma over time, but research shows that unprocessed trauma can resurface in adulthood in the form of anxiety, depression, or attachment issues. Others assume that trauma therapy means forcing children to relive painful memories. But in reality, the goal is to gradually help them build resilience, not re-traumatize them. In recent years, trauma therapy has also expanded into family-centered approaches, recognizing that healing does not happen in isolation. Therapies like child-parent psychotherapy focus on strengthening the caregiver-child bond, ensuring that parents and guardians are equipped with the tools to support their child's emotional recovery. With advances in neuroscience and psychotherapy, trauma-informed care continues to evolve, offering hope and healing to children who have endured life-altering experiences. The message at the heart of this therapy is simple but profound. No child is broken by trauma. They just need the right support to rebuild their sense of safety, trust, and self-worth.